I'd like to talk about my study, which talking about the diagnosis delay in RA patient. So, in my introduction, active rheumatoid arthritis is characterized by inflammation of synovial tissue, which, if untreated, leads to permanent structural damage and eventually long-term disability. Around 90% of RA patients have some form of disability within 2 decades of onset, and early diagnosis and treatment of RA is of paramount importance. There are obstacles to early diagnosis and treatment, including the initial delay on the part of the patient to seek medical care, followed by delay in the primary care. Early referral followed by diagnosis of RA and initiation of treatment during the early inflammatory stages will improve patient outcome and long-term quality of life. There is a little data available on diagnostic delay among patients with RA in Saudi Arabia. Therefore, this study aims to evaluate the characteristic features and to determine the time lag between the duration of first joint symptom before seeking medical advice and to determine the delay in diagnosis. And our definition delay diagnosis, which is the time between the initiation of referral and establishment of diagnosis among RA patients who registered in SAR, Saudi Arthritis Registry. Regarding the methods, it was retrospective multi-center study involving RA patients in Saudi Arabia who were followed up in rheumatology clinic in 5 hospitals. Bin Sultan Military Medical City, which is a lot of our patients belong from this hospital, followed by King Khalid Hospital in Majma'a and King Fehed Hospital in Jeddah, then King Fehed Military Medical Complex in Dhahran and Prince Mohammed bin Abdul Aziz Hospital in Riyadh. So we have 668 patients were included in the study who were diagnosed based on the 2010 ACR EULAR criteria. Our inclusion criteria was all adult RA patient aged 16 years and above, and we exclude any other rheumatoid disease. The data was extracted from SAR, which include the patient features and the patient features and the family history was considered positive if at least one of the first-degree relatives had been diagnosed with RA and symptom duration was recorded. This is the statistics analysis. We use the 28th version, SPSS. So regarding the results, around 85% from our patients are female, and the median age of patients was 43 years. 3.7 of our patients, they have a positive family history of RA. Regarding the occupation, around the 60% are employee and 40% unemployed. Regarding the education, around half, less than 2% of our patients, they have PhD or master degree, and the rest of percentage between 20 to 30% distributed among the other educational degree. Regarding the distribution duration of first joint symptom before seeking medical advice, more than 2/3, around half of our patients, they are seeking medical advice 5 months and below, and 1/3 of them, they are seeking medical advice after 1 year. Regarding the distribution number of healthcare provider visits prior to be seen in rheumatology clinic, around the majority of our patients, around 2/3 of our patients, they have been seen by 1 to 2 doctors before to be referred to the rheumatology clinic. Regarding the sources of referral, the majority of them, we received our patient from a GP, followed by internal medicine, orthopedics, emergency, and others. Delay in diagnosis. The median delay in diagnosis is 16.42 in the weeks, which equal to 3.83 in the months. Here we have, and we'd like to look for any association between the first joint symptom before seeking medical advice and different parameters. The first one, we'd like to look for the education. And honestly, we can see here the patient who have PhD and master degree have a high delay percentage to seeking medical advice. Regarding the family history, we couldn't find any association between the positive family history and seeking medical advice, but around 72% of patients who have a positive family history, they are seeking medical advice in less than 5 months compared with the others. Regarding the gender, we found here a significant association between the gender and the duration before seeking medical advice. Around 49% they are female who are seeking medical advice, which is between 1 to 5 months, and the male around 47.5, between 3 to 11 months. We couldn't find any association between the age and the duration of first joint symptom before seeking medical advice. Regarding my discussion, in the current study, the median age of RA patients were 43 years, and the majority of them were female, and this is the consistency with a lot of other published reports. Other studies prove that patients making a mean of 4 healthcare provider visits before to be seen by a rheumatologist, while in our study we found around 67.35% of our patients visit 1 to 2 doctors before to be seen by a rheumatologist. This research highlights that only 22 of patients were seeking medical advice within the first 3 months of the symptom onset, and it appears comparable to the other European country reported. As we know, delay in initiation of treatment after diagnosis of RA has been established, and it's associated with the progression of joint damage. So we have international studies have shown that only between 20 to 30 of RA patients are assessed by rheumatologists within 12 weeks, and the median delay was 23 weeks. Our cross study showed that the median delay is 16.42 weeks. I found an interesting study from Al Medina, which showed that the high level of education had a high prevalence of a delay, around 72%, in seeking medical care among the participants, and I think it looks like to be comparable to our study. What's the strength and limitation points of our study? This study surveyed a good sample of patients from multiple medical centers registered in SAR. And also the participants were recruited from multiple hospitals to identify delays in access to care. And regarding the limitation, the study didn't explore the factors that have an impact on the delay of delayed time of diagnosis and the interval time between the first consultation with the rheumatologist and initiation of a treatment was not measured. Conclusion. This study identified delays at many levels in the pathway toward assessment by rheumatologists. Female RA patients seek medical advice earlier than male. Early refer to rheumatologist for a definitive diagnosis, and early start treatment should improve long-term outcome of RA. I would like to extend my deep thanks to my research team, دكتورة حنان الريس, دكتورة سلطانة عبد العزيز, دكتورة خولة الغانم, والدكتورة حنان الحمزي. Thank you so much.